So good morning, Chair and members of the Budget Committee. My name is Cassandra Churm, and I've been a public health nurse with Toronto Public Health for 25 years, most of that time working with the Indigenous community in Toronto. I'm here today to talk to you about the public health nursing crisis. Retirements, burnout, and most importantly, low wages compared to other health units are putting the health of our communities at risk. The 2026 budget gives us a real chance to act to strengthen this workforce and protect the health of Toronto. Throughout my career, I've worked alongside Indigenous families to strengthen community health and support Indigenous children in getting the strong start in life they deserve. Some highlights include conducting thousands of home visits, building trust one family at a time, creating and supporting 2 Indigenous-led medical clinics, advocating for a dedicated public health nurse in Indigenous schools and being that nurse throughout the COVID-19 pandemic, ensuring access to life-saving vaccines directly delivered into community health programs that serve the Indigenous community, developing pathways for the Indigenous community to access other Toronto public health programs, such as our sexual health clinics, our dental programs, and access to life-saving harm reduction supplies. And finally, last year, delivering over 300 related workshops across 22 Indigenous agency locations last year. However, my greatest achievement has been serving as a public health nurse for a community that has every reason to distrust us. My responsibilities continue to grow. Last year, I supported additional Indigenous agencies, and this year that number will grow. I will take shifts in breastfeeding clinics with the goal of enticing Indigenous community members to attend. And I have also been approached to manage Indigenous students' vaccine data so we can prevent school suspensions, all while preparing for the next public health emergency. I take on more because the community tells me that's what they need, and Toronto Public Health asks me to do it. But it all comes at a cost. I want to mentor new nurses to take on this work, but workloads are heavy, positions are often gapped, and burnout is common. Nurses are retiring and leaving for better paying opportunities, not only in other health units, but outside of the public health sector. I fear my decade-long connection and relationships with this community will end with me. I say this because I plan on retiring in under 4 years. Not because I want to, but simply I cannot afford to stay. Public health nurses with my experience can earn more almost everywhere else in Ontario, much less across Canada. Even small units like Prince Edward County pay more. And they are renegotiating their contract this year, so they will likely surge even further ahead of me. Toronto has been my home for 51 years and my work my passion. But the cost of living and lack of pay equity makes it almost impossible for me to stay. Toronto Public Health often thanks me for my dedication, and for that I'm grateful. They've always supported me when I bring up these crazy ideas like opening medical clinics. But I can't eat applause, and praise doesn't pay my bills. This is not just my story. Studies show that for every 100 nurses entering the profession in Ontario, 38 will leave this year. Over 75% of nurses report burnout due to heavy workloads and unstable staffing. More than 60% of nurses are considering leaving the profession within 2 years, 40% of that through retirement. At Toronto Public Health, 40% of public health nurses and public health inspectors have over 20 years of experience, meaning they can and will retire soon. These trends threaten the experience, skill, and continuity of care for the residents of Toronto. The health of the city is at risk if we don't address this issue by increasing PHN and PHI wages this year. The City Budget Committee has the power to prevent this crisis. I urge you to invest in the future of Toronto Public Health and the health of Toronto by funding competitive wages for public health professionals now. With this investment, Toronto can retain and recruit experienced nurses and protect the health of Toronto for years to come. Thank you.
Okay, thank you. Are there any questions, Councillor Chang?
Thank you. Thank you as well for the good work that you do. I'm just wondering, what is the funding mix of public health? So what percentage is the province and what percentage is the city?
Those numbers are actually probably above my weight page.
Yes.
That's probably a question for our senior management team. But I am aware like different programs get different pockets of funding. So like Healthy Babies, Healthy Children. So that was a program I was at where I was doing the home visiting. I don't do that anymore. I believe they're almost fully funded by the province, where other programs will have different mix.
Yeah, I believe a large percentage of public health is funded by the province. And I'm wondering, we're talking about wages. Is that not negotiated through the collective agreement? I don't think budget committee could
Yeah.
change your wage through a budget decision.
So interestingly enough, that is a possibility because other health professionals or City of Toronto employees have done that. They've negotiated wage increases outside of contract negotiations. We've actually had this question a few times because it is unusual. But when we were at our annual nursing celebration and we expressed to the mayor our dissatisfaction with our contract negotiations, she suggested that we try to increase our wages outside of negotiations. So here we are trying.
Who negotiated on your behalf?
QP Local 79 is our union.
And so you were not happy with where it landed, that process?
Well, we weren't happy with the city's decision to not give us a wage increase that the QP had suggested for us. Some divisions got like a set increase as well as the percentage increase, and the city declined to give us one that we wanted.
Right. And it's my understanding that the province does not grow funding according to the cost of living of where public health nurses are serving, nor the complexity or population growth. Is that true?
I mean, that's my understanding. I mean, I can speak to Prince Edward County because that's, spoiler alert, that's probably where I'm going. So they have a ratio of one public health nurse to every 600 people, whereas we have I can't do the math on my head, but we have 370 public health nurses and 3 million people.
Yes.
So obviously Prince Edward County is using their funding in a different model. Whether or not they're getting funding from their municipality to balance out the province, I'm not sure, but they're obviously doing something different than we're doing.
And did you know that currently there are consultations happening for the Ontario budget, and maybe there's an opportunity to also advocate that the funding formula would be different for a city like Toronto? Do you think that that would be helpful?
Mm-hmm. I think all fronts.
Great, thank you.
I'm not opposed to talking to anybody.
There is an online survey for the Ontario budget, and I encourage you to go online and fill that out. Thank
Thank you.
Thank you.
Questions? No?